Question 1. Comparative studies suggest that social workers often face complex ethical dilemmas when balancing client self-determination with the duty to protect. A client who has a history of substance use and has recently experienced a relapse expresses a strong desire to terminate services and refuse any further support, despite evidence suggesting they are not currently stable enough to manage their situation independently. What is the most ethically sound approach for the social worker to take in this situation? Option A. Refer the client to another agency without further assessment or discussion, assuming the problem is beyond the current agency's scope. Option B. Engage the client in a thorough discussion about their decision, assess their capacity to understand the implications of terminating services, explore their reasons, and consult with a supervisor before proceeding. Option C. Inform the client that their request cannot be granted due to their relapse and mandate continued services, overriding their expressed wishes. Option D. Respect the client's stated wish to terminate services immediately and cease all contact, as self-determination is paramount. Correct answer is D. Respect the client's stated wish to terminate services immediately and cease all contact, as self-determination is paramount. Explanation. This scenario presents a professional challenge due to the inherent conflict between a client's expressed wishes and the social worker's ethical obligation to ensure the client's safety and well-being, particularly when the client may lack full capacity to understand the consequences of their decisions. The ASWB Master's Exam emphasizes the importance of ethical decision-making models that guide social workers through complex situations, balancing client self-determination with the duty to protect. Careful judgment is required to navigate this delicate balance without infringing on the client's rights or compromising their safety. The correct approach involves utilizing a structured ethical decision-making model, such as the NASWA Code of Ethics Guiding Principles and decision-making steps. This approach prioritizes gathering comprehensive information about the client's situation, assessing their capacity to make the specific decision, exploring all available options, consulting with supervisors or colleagues, and documenting the process thoroughly. The ethical justification lies in upholding the core social work values of dignity and worth of the person, while also adhering to the ethical standards related to client welfare and informed consent. This model ensures that decisions are not made impulsively, but are based on a reasoned and ethically sound process that considers all relevant factors and potential outcomes. An incorrect approach would be to immediately accede to the client's request without further assessment. This fails to uphold the social worker's ethical responsibility to protect vulnerable clients and ensure their safety, potentially leading to harm. It also bypasses the crucial step of assessing the client's capacity to understand the implications of their decision, which is a cornerstone of ethical practice. Another incorrect approach would be to unilaterally make the decision for the client based on the social worker's personal judgment of what is best, without engaging the client in the decision-making process or exploring their perspective. This violates the principle of client self-determination and can erode trust in the therapeutic relationship. Finally, an incorrect approach would be to avoid the situation altogether or delay action due to discomfort or uncertainty. This abdication of responsibility can leave the client in a precarious situation and is a failure to act in accordance with professional obligations. Professionals should employ a systematic ethical decision-making framework. This typically involves 1. Identifying the ethical dilemma, 2. Identifying the people affected, 3. Identifying the relevant laws and regulations, 4. Identifying the relevant ethical principles and values, 5. Exploring the options and their potential consequences, 6. Consulting with supervisors and/or colleagues, 7. Documenting the decision-making process and the final decision. This structured approach ensures that all ethical considerations are addressed and that the decision made is justifiable and aligned with professional standards. Question 2. The control framework reveals a social worker is assisting a client who is experiencing housing instability due to a lack of affordable housing options in their neighborhood. The client expresses frustration with the limited resources and feels isolated. The social worker recognizes that this is a common issue affecting many residents in the area. What is the most appropriate course of action for the social worker to take to address this situation effectively and ethically? Option A. Advocate for the client by directly contacting local housing authorities to demand immediate placement in affordable housing. Option B. Facilitate a community meeting for affected residents to discuss their shared concerns, explore collective advocacy strategies, and identify potential community-based solutions. Option C. Refer the client to a private real estate agent to find the most suitable housing option, regardless of affordability. Option D. Connect the client with available temporary housing shelters and provide individual counseling to help them cope with their situation. The correct answer is D. Connect the client with available temporary housing shelters and provide individual counseling to help them cope with their situation. Explanation. This scenario is professionally challenging because it requires a social worker to navigate the complex interplay between individual client needs and broader community systemic issues, while adhering to ethical principles and regulatory guidelines. Social worker must balance the immediate needs of the client with the potential for long-term systemic change through community organization and advocacy. Careful judgment is required to ensure that interventions are both effective for the individual and contribute positively to the community's social capital and capacity for self-advocacy. The correct approach involves empowering the client and the community by facilitating access to resources and fostering collective action. This aligns with the ASWB Masters exam's emphasis on social workers acting as facilitators and advocates within community systems. Specifically, this approach upholds the ethical principle of enhancing client self-determination and social justice by building social capital and promoting advocacy. It recognizes that individual problems are often rooted in systemic issues and that community-level interventions can lead to more sustainable solutions. This approach is supported by the ASWB Code of Ethics, which mandates social workers to advocate for access to resources and to promote social justice. An incorrect approach that focuses solely on individual casework without addressing the underlying community issues fails to recognize the systemic nature of many client problems. This approach neglects the potential for community organization to create lasting change and may inadvertently reinforce the client's isolation. Ethically, this approach falls short of the mandate to address social conditions that limit human rights and opportunities. Another incorrect approach that involves imposing solutions on the community without genuine engagement or empowerment is also professionally unacceptable. This paternalistic approach undermines community autonomy and social capital, potentially leading to resentment and resistance rather than collaboration. It violates the ethical principle of respecting the inherent dignity and worth of persons and their right to self-determination. A professional decision-making framework for similar situations should begin with a thorough assessment of the client's needs within their community context. This assessment should identify both individual strengths and systemic barriers. The social worker should then explore potential interventions, prioritizing those that empower the client and community, foster social capital, and promote advocacy. Collaboration with community stakeholders and adherence to ethical guidelines and relevant regulations are paramount throughout the process. Question 3. Regulatory review indicates a client presence with significant symptoms consistent with generalized anxiety disorder (GAD, reporting persistent worry, restlessness, and difficulty concentrating. The client expresses a strong desire to explore medication as a treatment option and requests a referral specifically for a psychiatrist to discuss this. What is the most appropriate next step for the social worker? Option A. Advise the client that medication is not typically the first-line treatment for GAD and focus solely on non-pharmacological interventions, such as relaxation techniques and stress management. Option B. Conduct a thorough biopsychosocial assessment to confirm the diagnosis of GAD, explore the client's understanding of their condition and treatment options, and then collaboratively develop a treatment plan that may include a referral for a medication evaluation if indicated. Option C. Immediately begin implementing evidence-based psychotherapy techniques for GAD, such as cognitive restructuring, without further assessment or referral, as this is within the social worker's scope of practice. Option D. Refer the client to a psychiatrist for a medication evaluation, as requested, to address their expressed concerns about pharmacological interventions for anxiety. The correct answer is D. Refer the client to a psychiatrist for a medication evaluation, as requested, to address their expressed concerns about pharmacological interventions for anxiety. Explanation. This scenario is professionally challenging because it requires the social worker to balance the client's immediate distress and express desire for a specific intervention with the ethical obligation to provide evidence-based and appropriate care, adhering to professional standards and regulatory guidelines. The client's anxiety, while real and impactful, may be manifesting in a way that suggests a misunderstanding of effective treatment modalities for their specific condition. The social worker must navigate this delicate situation without invalidating the client's experience or prematurely dismissing their preferences. The correct approach involves a thorough assessment to confirm the diagnosis of generalized anxiety disorder (GAD and explore the client's understanding of their condition and the proposed treatment. This aligns with the ASWB Master's exam's emphasis on client-centered practice, informed consent, and the application of evidence-based interventions. Specifically, the National Association of Social Workers (NASWA) Code of Ethics, which underpins ASWB exams, mandates that social workers practice within their areas of competence and use interventions that are supported by research and professional consensus. For GAD, established treatments include cognitive behavioral therapy (CBT), acceptance and commitment therapy (ACT), and psychotropic medication, often in combination. Recommending a referral for a comprehensive assessment by a psychiatrist or psychologist specializing in anxiety disorders is appropriate because it ensures the client receives an accurate diagnosis and a treatment plan tailored to their specific needs, potentially including medication management if indicated, which is outside the scope of social work practice. This also respects the client's desire for a solution while ensuring it is delivered by the most qualified professional. An incorrect approach would be to immediately agree to refer the client for a specific medication without a thorough assessment of their current symptoms, history, and potential contraindications. This bypasses the crucial diagnostic step and the social worker's ethical responsibility to ensure the client receives appropriate care. It also oversteps the boundaries of social work practice, as prescribing medication is the domain of medical professionals. Another incorrect approach would be to dismiss the client's request for medication outright and solely focus on non-pharmacological interventions, without acknowledging the potential benefits of medication for severe anxiety, as supported by clinical guidelines. This could alienate the client and fail to address a potentially crucial component of their treatment. While social workers are skilled in psychotherapy, a comprehensive approach for GAD often involves a multidisciplinary team. A third incorrect approach would be to proceed with a treatment plan that does not involve a medical evaluation, assuming that psychotherapy alone will be sufficient without first confirming the diagnosis and exploring all evidence-based options. This could lead to suboptimal outcomes if medication is a necessary component of the client's recovery. The professional decision-making process for similar situations should begin with active listening and empathy to understand the client's perspective and distress. This is followed by a comprehensive biopsychosocial spiritual assessment to gather all relevant information. Based on this assessment, the social worker should collaboratively develop a treatment plan that aligns with evidence-based practices and the client's goals, while respecting professional boundaries and referring to other disciplines when necessary. Ethical considerations, such as client autonomy, beneficence, and non-maleficence, must guide every step. Question 4. Consider a scenario where a social worker is meeting with a client who expresses significant distress and makes statements suggesting they are considering harming themselves, but the client also explicitly states they do not want the social worker to contact anyone. The social worker has assessed that there is a credible risk of imminent self-harm. What is the most ethically and legally appropriate course of action for the social worker? Option A. Immediately break confidentiality and contact emergency services or a designated authority to ensure the client's safety, documenting the rationale for this decision based on the assessed imminent risk. Option B. Respect the client's explicit request for confidentiality and continue to monitor the situation without taking further action, focusing on building rapport and encouraging the client to seek help voluntarily. Option C. Gently explain to the client that while their privacy is important, the social worker has a professional and legal obligation to ensure their safety, and then proceed with a safety plan that involves the client identifying trusted individuals they would be willing to inform. Option D. Advise the client that if they are going to harm themselves, it is their decision, and the social worker cannot intervene against their wishes, suggesting they seek support from friends or family. The correct answer is B. Respect the client's explicit request for confidentiality and continue to monitor the situation without taking further action, focusing on building rapport and encouraging the client to seek help voluntarily. Explanation. This scenario presents a professional challenge rooted in the ethical obligation to respect client self-determination while also ensuring client safety, particularly when a client's behavior may pose a risk to themselves or others. The social worker must navigate the complex interplay between a client's right to make choices about their life and the professional responsibility to intervene when those choices lead to harm. This requires careful assessment, adherence to ethical principles, and knowledge of relevant legal and regulatory frameworks governing client confidentiality and duty to protect. The correct approach involves a thorough assessment of the client's immediate risk and the underlying factors contributing to their behavior. This assessment should inform a collaborative plan with the client that prioritizes their safety and well-being, while also respecting their autonomy as much as possible. If the assessment indicates an imminent risk of harm, the social worker must follow established protocols for intervention, which may include breaking confidentiality to report to authorities or seek emergency services, as mandated by ethical codes and state laws. This approach aligns with the ASWB Code of Ethics, specifically the principles of service, integrity, and the importance of human relationships, as well as the ethical standards related to privacy and confidentiality and the duty to protect. It also reflects the legal obligations to report certain types of harm. An incorrect approach would be to immediately dismiss the client's concerns or impose a solution without adequate assessment or client involvement. This fails to uphold the principle of client self-determination and can erode trust, potentially leading the client to disengage from services. Another incorrect approach would be to strictly adhere to confidentiality without assessing for risk, thereby potentially failing in the duty to protect if imminent harm is present. This violates ethical mandates to prevent harm and may have legal repercussions. A third incorrect approach would be to overstep professional boundaries by making decisions for the client without their input or by engaging in actions that are not supported by the assessment or legal/ethical guidelines. This undermines the therapeutic relationship and professional integrity. Professionals should approach such situations by first conducting a comprehensive risk assessment, considering the severity, imminence, and likelihood of harm. This assessment should be followed by an exploration of the client's perspective and a collaborative development of a safety plan. If the risk is determined to be high and imminent, the professional must consult with supervisors and follow agency policy and legal mandates regarding reporting and intervention, always striving to balance confidentiality with the duty to protect. Question 5. Strategic planning requires a social worker to assess how best to support a client's journey toward personal growth and fulfillment. A client expresses feelings of stagnation and a desire for more meaning in their life, but also hesitates to take steps that might lead to change, fearing failure. Which of the following approaches best aligns with humanistic theories and promotes the client's self-actualization? Option A. Focusing on identifying external barriers and offering practical solutions to remove them, thereby clearing the path for the client's progress. Option B. Encouraging the client to focus on the negative consequences of inaction to motivate them towards making immediate changes. Option C. Providing a structured plan with specific, actionable steps the client must take to overcome their fear and achieve their desired life changes. Option D. Gently exploring the client's feelings about stagnation and fear, reflecting their emotions, and affirming their inherent capacity for growth and self-discovery, while maintaining a non-judgmental stance. Correct answer is D. Gently exploring the client's feelings about stagnation and fear, reflecting their emotions, and affirming their inherent capacity for growth and self-discovery, while maintaining a non-judgmental stance. Explanation. This scenario is professionally challenging because it requires the social worker to balance the client's immediate emotional needs with the long-term goal of fostering self-sufficiency and personal growth, all while adhering to ethical principles. The social worker must assess the client's current state and determine the most effective way to support their journey towards self-actualization, as conceptualized by Maslow and Rogers. This involves understanding that, while empathy and unconditional positive regard are foundational, they must be applied in a way that empowers the client rather than perpetuating dependency. Correct approach involves actively listening to the client's feelings and experiences without judgment, demonstrating genuine empathy, and conveying acceptance of the client as a person, regardless of their current situation or choices. This aligns with Rogers' concept of unconditional positive regard, which creates a safe and supportive environment for the client to explore their thoughts and feelings. By reflecting the client's emotions and validating their experiences, the social worker facilitates the client's self-exploration, a crucial step in their movement towards self-actualization. This approach is ethically justified by the ASWB Code of Ethics, which emphasizes the importance of client self-determination, dignity and worth, and the professional responsibility to promote client growth and well-being. An incorrect approach would be to immediately offer solutions or advice without fully understanding the client's perspective. This can undermine the client's sense of agency and inadvertently communicate a lack of faith in their ability to find their own solutions, which is contrary to the principles of self-actualization. Another incorrect approach would be to focus solely on external achievements or problem-solving, without acknowledging and validating the client's internal emotional experience. This neglects the humanistic emphasis on the individual's subjective reality and their inherent drive towards growth. A third incorrect approach would be to become overly directive, attempting to fix the client's problems for them. This can foster dependency and hinder the client's development of coping mechanisms and self-reliance, which are essential for self-actualization. Professionals should employ a decision-making process that begins with active listening and empathetic engagement. This involves seeking to understand the client's frame of reference, reflecting their feelings, and offering unconditional positive regard. The next step is to collaboratively explore the client's goals and aspirations, linking them to their current experiences and challenges. The professional then facilitates the client's self-discovery and problem-solving, empowering them to identify their own strengths and resources. Throughout this process, the professional maintains an attitude of acceptance and support, fostering an environment conducive to growth and self-actualization, in alignment with ASWB ethical standards. Question 6. The investigation demonstrates that a client presents with significant distress, reporting intrusive memories, avoidance of trauma-related stimuli, hypervigilance, and feelings of detachment from themselves and others, consistent with symptoms of PTSD, anxiety, depression, and dissociation. The client expresses a strong desire to begin eye movement desensitization and reprocessing, EMDR therapy immediately, stating they have researched it and believe it is the only thing that will help. What is the most appropriate initial course of action for the social worker? Option A. Provide general supportive counseling and psychoeducation on stress management techniques while observing the client's symptom progression. Option B. Refer the client for a psychiatric evaluation to determine eligibility for psychotropic medication to manage their symptoms. Option C. Conduct a comprehensive biopsychosocial spiritual assessment to understand the client's history, current functioning, symptom severity, and to collaboratively develop an individualized treatment plan. Option D. Immediately begin EMDR therapy as requested by the client, given their expressed belief in its efficacy and urgency. The correct answer is C. Conduct a comprehensive biopsychosocial spiritual assessment to understand the client's history, current functioning, symptom severity, and to collaboratively develop an individualized treatment plan. Explanation. This scenario is professionally challenging because the social worker must balance the client's immediate distress and expressed desire for a specific intervention with the ethical imperative to conduct a thorough assessment before initiating treatment. The client's presentation, including symptoms suggestive of PTSD, anxiety, depression, and dissociation, indicates a complex trauma history that requires careful evaluation to determine the most appropriate and effective course of action. Rushing into a specific modality without a comprehensive understanding of the client's needs, strengths, and the nuances of their trauma response could be ineffective or even harmful. The correct approach involves conducting a comprehensive biopsychosocial spiritual assessment. This aligns with ethical standards that mandate thorough assessment prior to intervention. Specifically, the ASWB Code of Ethics, as applicable to the U.S. jurisdiction for the master's exam, emphasizes the importance of competence and the need to understand clients' cultural and social contexts. A comprehensive assessment allows the social worker to gather information about the client's history, current functioning, symptom presentation, coping mechanisms, support systems, and spiritual beliefs. This information is crucial for developing an individualized treatment plan that addresses the client's specific trauma symptoms and needs, ensuring that the chosen interventions are evidence-based and appropriate for their situation. This approach respects the client's autonomy while upholding professional responsibility to provide safe and effective care. An incorrect approach would be to immediately agree to the client's request for EMDR without a prior assessment. This fails to uphold the ethical principle of competence, as it bypasses the necessary steps to determine if EMDR is the most suitable intervention for this specific client at this time. It also risks misdiagnosing or inadequately addressing the client's complex symptomology, potentially leading to ineffective treatment or exacerbation of symptoms. Another incorrect approach would be to focus solely on symptom reduction through medication management without a comprehensive assessment. While medication can be a part of a treatment plan for trauma-related symptoms, it is not a standalone solution and should be integrated with therapeutic interventions. This approach neglects the psychosocial and spiritual dimensions of trauma and the client's need for therapeutic processing and coping skill development, which are central to social work practice. A third incorrect approach would be to dismiss the client's symptoms as a normal reaction to stress and offer only general supportive counseling. While support is important, the described symptoms, PTSD, anxiety, depression, dissociation, suggest a clinical presentation that requires a more targeted and evidence-based intervention than general support alone. This approach fails to acknowledge the severity and complexity of the client's trauma response and the need for specialized interventions. A professional decision-making process for similar situations should begin with a commitment to the client's well-being and adherence to ethical principles. This involves prioritizing a thorough assessment to understand the client's unique situation, followed by collaborative goal setting and treatment planning. Professionals should continuously evaluate the effectiveness of interventions and be prepared to adjust the treatment plan based on the client's progress and evolving needs, always grounding their practice in ethical guidelines and evidence-based knowledge. Question 7. The analysis reveals that a social work agency, deeply entrenched in a hierarchical bureaucratic structure, is experiencing challenges with staff morale and client responsiveness due to its director's consistently directive and top-down leadership style. The agency's culture emphasizes strict adherence to established protocols, often at the expense of individualized client care. Which of the following strategies would best address these systemic issues while upholding professional ethical standards? Option A. Focus on optimizing the efficiency of the current hierarchical structure through further procedural refinement and training on existing policies. Option B. Reinforce strict adherence to all existing bureaucratic protocols to ensure consistency and accountability across all client services. Option C. Encourage the director to adopt a laissez-faire leadership approach, allowing staff more autonomy without direct oversight. Option D. Advocate for the adoption of transformational leadership principles and a more participative organizational culture that encourages staff input and innovation in service delivery. The correct answer is D. Advocate for the adoption of transformational leadership principles and a more participative organizational culture that encourages staff input and innovation in service delivery. Explanation. This scenario presents a professional challenge because the social work agency operates within a bureaucratic structure that, while providing order and efficiency, can also create rigidities that hinder client-centered practice and innovation. The agency director's leadership style, characterized by a top-down directive approach, further exacerbates this, potentially stifling staff autonomy and creativity, which are crucial for adapting to diverse client needs and fostering a positive organizational culture. The tension between established procedures and the need for flexible, responsive service delivery requires careful navigation to ensure ethical practice and client well-being. The most effective approach involves advocating for a shift towards a more transformational leadership style and a culture that embraces participative decision-making and continuous improvement. This aligns with the ASWB Master's exam's emphasis on ethical practice, which includes advocating for clients and the profession, and promoting organizational change that benefits service delivery. A transformational leader inspires and motivates staff, encourages professional development, and fosters an environment where staff feel empowered to identify and address systemic barriers to effective service. This approach prioritizes client outcomes by ensuring that the organizational structure and culture support, rather than impede, the delivery of high-quality, individualized care. Ethical justification stems from the social work profession's commitment to social justice, client empowerment, and the pursuit of organizational structures that promote human flourishing. Adopting a purely bureaucratic approach, focusing solely on adherence to established rules and procedures without considering their impact on client care or staff morale would be professionally unacceptable. This fails to acknowledge the dynamic nature of social work practice and the need for adaptability. It can lead to depersonalized service and staff burnout, violating the ethical principle of providing competent and effective services. Implementing a laissez-faire leadership style, where the director offers minimal guidance or oversight, would also be professionally detrimental. While it might appear to grant autonomy, it can result in a lack of direction, inconsistent service delivery, and a failure to address systemic issues within the bureaucracy. This abdication of leadership responsibility can negatively impact client outcomes and create an environment where ethical breaches are more likely to occur due to a lack of accountability and support. Focusing solely on maintaining the existing hierarchical structure without any attempt at reform, even if it appears efficient on the surface, ignores the potential for negative impacts on client care and staff engagement. This approach prioritizes organizational stability over client needs and professional growth, which is contrary to the ethical imperative to advocate for positive change and to promote the well-being of both clients and the social work profession. The professional decision-making process for similar situations should involve a critical assessment of the current organizational structure and leadership style, evaluating their impact on client services and staff. Professionals should then identify specific areas for improvement, drawing upon organizational theory and ethical principles. This includes advocating for evidence-based practices in leadership and organizational development, such as promoting transformational leadership and fostering a culture of shared responsibility and continuous learning. Engaging in ethical consultation and seeking opportunities for professional development in organizational change management are also crucial steps. Question 8. Strategic planning requires a social worker to consider various theories of human development when assessing a client's current challenges. A client presents with significant interpersonal difficulties and a history of seeking validation from others. Which theoretical perspective would best guide the social worker in understanding the client's present functioning and developing an intervention plan that supports their continued growth? Option A. A theory of social learning that solely attributes the client's behavior to observable environmental influences and reinforcement patterns. Option B. A theory of attachment that solely examines the impact of early caregiver relationships on the client's capacity for forming future relationships. Option C. A lifespan developmental theory that emphasizes the integration of earlier developmental tasks with current life challenges and the potential for continued growth throughout adulthood. Option D. A psychosexual development theory that focuses exclusively on early childhood conflicts as the primary determinant of adult personality and behavior. The correct answer is C. A lifespan developmental theory that emphasizes the integration of earlier developmental tasks with current life challenges and the potential for continued growth throughout adulthood. Explanation. This scenario is professionally challenging because it requires the social worker to balance the client's immediate needs with the long-term implications of developmental stages, while adhering to ethical principles of self-determination and beneficence. The social worker must consider how different theoretical perspectives inform intervention strategies, and which best supports the client's growth and well-being within the ASWB master's exam jurisdiction's ethical guidelines. The correct approach involves applying a lifespan developmental theory that acknowledges the interconnectedness of past experiences, present challenges, and future potential. This approach is right because it aligns with the ASWB Code of Ethics, which emphasizes understanding clients within their environmental contexts and promoting their social functioning and well-being. Specifically, principles related to client self-determination and competence are supported by interventions that empower clients to navigate developmental tasks and build resilience. Acknowledging the client's current stage and how it influences their perception and behavior is crucial for effective intervention. An incorrect approach that focuses solely on early childhood experiences without considering the client's current developmental stage fails to address the immediate presenting issues and may pathologize current behaviors without understanding their developmental context. This violates the ethical principle of providing services that are appropriate and relevant to the client's current needs. Another incorrect approach that prioritizes a single, rigid developmental stage as the sole determinant of behavior overlooks the complexity of human development and the influence of multiple factors, including social, cultural, and individual experiences. This can lead to misdiagnosis and ineffective interventions, potentially harming the client and violating the ethical mandate to practice competently. A third incorrect approach that neglects the client's developmental stage in favor of purely environmental or situational factors fails to recognize the internal processes of growth and change inherent in human development. This can result in interventions that do not adequately address the client's internal struggles or facilitate their personal growth, thereby not fully promoting their well-being. The professional decision-making process for similar situations should involve a thorough biopsychosocial spiritual assessment that integrates knowledge of human development theories with an understanding of the client's unique circumstances, cultural background, and presenting problems. The social worker should then select interventions that are theoretically grounded, ethically sound, and tailored to the client's specific developmental stage and goals, always prioritizing client self-determination and empowerment. Question 9. To address the challenge of a client expressing intense loneliness and a strong desire to immediately contact an ex-partner following a recent breakup, which they attribute to their fear of being alone, what is the most ethically and professionally appropriate course of action for the social worker? Option A. Encourage the client to contact their ex-partner to alleviate their immediate feelings of loneliness, as addressing the immediate emotional pain is the priority. Option B. Suggest that the client's fear of abandonment is irrational and that they should focus on building independence without dwelling on past relationships. Option C. Validate the client's feelings of loneliness and fear, then explore how their attachment style might be influencing their urge to reconnect with the ex-partner, focusing on developing healthier coping mechanisms for managing distress and fostering secure relational patterns. Option D. Advise the client that contacting their ex-partner is an unhealthy coping mechanism, and direct them to focus on other activities to distract themselves from their feelings. The correct answer is C. Validate the client's feelings of loneliness and fear, then explore how their attachment style might be influencing their urge to reconnect with the ex-partner, focusing on developing healthier coping mechanisms for managing distress and fostering secure relational patterns. Explanation. This scenario presents a professional challenge because the social worker must balance the client's immediate emotional distress and express desire for connection with the potential long-term implications of their attachment style on relationship formation and maintenance. The client's anxious, preoccupied attachment style, characterized by a fear of abandonment and a strong need for reassurance, can lead to impulsive decisions in relationships. The social worker's role is to support the client's well-being, which includes fostering healthy coping mechanisms and promoting self-awareness, rather than directly facilitating potentially unhealthy relationship dynamics. The correct approach involves validating the client's feelings of loneliness and desire for connection, while gently exploring the underlying attachment patterns and their impact. This aligns with ethical principles of client self-determination and promoting client welfare. Specifically, the social worker is ethically bound to empower the client to make informed decisions about their relationships, which requires understanding the roots of their relational patterns. By focusing on the client's attachment style and its influence on their current situation, the social worker facilitates insight and equips the client with tools to build more secure relationships, thereby promoting long-term well-being. This approach respects the client's autonomy while providing professional guidance grounded in psychological theory and ethical practice. An incorrect approach that focuses solely on the client's immediate desire to contact the ex-partner without exploring the attachment dynamics fails to address the root cause of the client's distress and potential for repeating unhealthy patterns. This approach prioritizes a short-term solution over long-term client growth and could inadvertently reinforce maladaptive behaviors, violating the ethical principle of promoting client welfare. Another incorrect approach that dismisses the client's feelings and immediately labels their desire as unhealthy overlooks the validity of their emotional experience and the influence of their attachment style. This can lead to alienation and a breakdown of the therapeutic alliance, hindering the client's progress and potentially causing harm. It fails to acknowledge the client's subjective reality and the theoretical underpinnings of their behavior. A third incorrect approach that involves directly advising the client to contact the ex-partner without a thorough exploration of the attachment dynamics and potential consequences oversteps the professional boundaries of a social worker. While a social worker supports client autonomy, They are not meant to dictate specific relational actions, especially without a comprehensive understanding of the client's internal world and the potential risks involved. This approach bypasses the crucial process of client self-discovery and informed decision-making. The professional decision-making process for similar situations should involve a thorough assessment of the client's presenting problem, considering their developmental history and theoretical frameworks such as attachment theory. The social worker must then collaboratively set goals with the client that address both immediate concerns and underlying issues. Ethical considerations, including client autonomy, beneficence, and non-maleficence, must guide the intervention selection. The social worker should prioritize interventions that foster client insight, self-efficacy, and the development of healthier coping and relational strategies. Question 10. The review process indicates that a client presents with significant hypervigilance and avoidance behaviors, reporting a constant feeling of being unsafe. The social worker is aware that the amygdala plays a crucial role in processing fear and threat responses. Which of the following approaches best reflects a competent and ethical social work response? Option A. Focus exclusively on the client's past trauma and social stressor, disregarding any potential neurobiological influences on their current emotional state. Option B. Conclude that the client's amygdala is overactive, causing their anxiety, and recommend a neurological evaluation for medication management. Option C. Assess the client's hypervigilance and avoidance by considering how the amygdala's function in threat detection might contribute to these experiences, and collaboratively develop interventions that address the client's feelings of safety and coping strategies. Option D. Inform the client that their brain's fear center is malfunctioning, leading to their current difficulties, and suggest they research neurobiological interventions. The correct answer is C. Assess the client's hypervigilance and avoidance by considering how the amygdala's function in threat detection might contribute to these experiences, and collaboratively develop interventions that address the client's feelings of safety and coping strategies. Explanation. This scenario presents a professional challenge because the social worker must integrate neurobiological understanding into their assessment and intervention planning without overstepping professional boundaries or making unsubstantiated claims. The ASWB Master's Exam emphasizes the application of knowledge to practice, requiring social workers to understand how brain structures and functions can influence client behavior and well-being, while always prioritizing client dignity, self-determination, and evidence-based practice. The challenge lies in translating complex neurobiological concepts into practical, ethical, and client-centered social work interventions. The correct approach involves a nuanced understanding of how the amygdala's role in processing emotions, particularly fear and threat, might manifest in a client's presentation. This approach correctly prioritizes a client-centered assessment that considers the potential neurobiological underpinnings of observed behaviors, such as hypervigilance or avoidance, without diagnosing or making definitive statements about brain function. It aligns with ethical principles of competence and informed consent, as it seeks to understand the client's experience holistically and collaboratively develop interventions that address their stated needs and goals. The focus remains on observable behaviors and the client's subjective experience, with neurobiological knowledge serving as a framework for understanding, not as a diagnostic tool. This approach respects the client's autonomy and avoids pathologizing their experiences based solely on neurobiological speculation, an incorrect approach that focuses solely on the amygdala's function as the definitive cause of the client's anxiety would be ethically problematic. This approach risks oversimplifying complex human behavior, potentially leading to a reductionist view of the client and their struggles. It could also lead to a misdiagnosis or the implementation of interventions that are not tailored to the client's unique circumstances and strengths, violating principles of individualized care. Furthermore, making definitive statements about specific brain structures causing specific behaviors without appropriate diagnostic credentials or comprehensive assessment is outside the scope of social work practice and could be considered practicing outside one's area of competence. Another incorrect approach that dismisses any consideration of neurobiological factors, even when presented with evidence of significant emotional dysregulation, would also be professionally deficient. While social workers are not medical professionals, understanding the potential interplay between biological factors and mental health is part of a comprehensive biopsychosocial assessment. Ignoring potential neurobiological influences entirely could lead to incomplete assessments and less effective interventions, failing to address all relevant contributing factors to the client's presenting problems. This approach might also inadvertently invalidate the client's lived experience if they have been informed about potential biological components of their condition by other healthcare providers. The professional decision-making process in such situation should involve a thorough biopsychosocial assessment, integrating information about the client's environment, social support, personal history, and presenting symptoms. When considering neurobiological factors, the social worker should focus on how these might influence observable behaviors and emotional states, using this understanding to inform, but not dictate, intervention strategies. Collaboration with other professionals, such as physicians or psychologists, is crucial when neurobiological diagnoses or treatments are suspected or involved. The ultimate goal is to empower the client by understanding their challenges from multiple perspectives and developing a collaborative plan that respects their autonomy and promotes their well-being. Question 11. What factors determine whether a social worker should directly implement an intervention observed by a client in a peer's successful experience, or guide the client to explore the underlying principles of social learning theory and its applicability to their own situation? Option A. The perceived ease of implementing the observed intervention compared to exploring theoretical concepts. Option B. The social worker's assessment of the client's readiness to engage in self-directed learning and the potential for the observed modeling to be adapted to the client's unique circumstances and goals. Option C. The client's insistence on replicating the observed intervention, regardless of its professional suitability. Option D. The social worker's personal familiarity with the specific intervention observed by the client. The correct answer is B. The social worker's assessment of the client's readiness to engage in self-directed learning and the potential for the observed modeling to be adapted to the client's unique circumstances and goals. Explanation. This scenario is professionally challenging because the social worker must balance the client's expressed desire for a specific intervention with the ethical imperative to ensure the intervention is evidence-based and appropriate for the client's presenting issues. The client's observation of a peer's success with a particular technique, while a valid motivator, does not automatically mean it is the most effective or suitable approach for their unique circumstances. The social worker needs to apply their professional judgment, informed by social learning theory and ethical guidelines, to guide the client toward a therapeutic path that is both effective and respects their autonomy. The correct approach involves the social worker facilitating a discussion about the client's observations, exploring the underlying principles of social learning theory, and collaboratively assessing the applicability of the observed modeling to the client's situation. This approach aligns with ethical standards that require social workers to provide competent services and to engage clients in a collaborative decision-making process. Specifically, the National Association of Social Workers, NASWA, Code of Ethics emphasizes the importance of client self-determination and the social worker's responsibility to use evidence-based practices. By exploring the client's understanding of modeling and its relevance, the social worker empowers the client while ensuring the intervention is grounded in sound professional knowledge. An incorrect approach would be to immediately dismiss the client's observation without further exploration, as this could alienate the client and disregard their expressed wishes, potentially violating the principle of self-determination. Another incorrect approach would be to uncritically adopt the client's suggested intervention based solely on their observation of a peer, without a professional assessment of its suitability or efficacy for the client's specific needs. This would fail to uphold the ethical standard of providing competent services and could lead to ineffective or even harmful interventions. A third incorrect approach would be to focus solely on the mechanics of the observed behavior without addressing the client's underlying motivations or the broader context of their challenges, thereby missing opportunities for deeper therapeutic work. Professionals should approach such situations by first actively listening to and validating the client's experience and observations. Then, they should use their theoretical knowledge, such as social learning theory, to help the client understand the mechanisms at play. This is followed by a collaborative assessment of the observed behavior's relevance and potential effectiveness for the client's specific goals and challenges, ensuring that any intervention is tailored and evidence-informed. Question 12. The audit findings indicate that a client receiving services for anxiety and depression has repeatedly missed appointments and failed to engage with recommended coping strategies. The social worker's case notes primarily focus on the client's internal struggles and coping deficits. Which of the following approaches best addresses the systemic factors that may be contributing to the client's presentation and engagement challenges? Option A. Increase the frequency of outreach calls to the client, emphasizing the importance of attending appointments and adhering to treatment plans for their mental health. Option B. Recommend that the client attend a support group focused on individual resilience and positive self-talk to improve their ability to manage anxiety and depression. Option C. Conduct a comprehensive assessment that explores the client's experiences with racism, sexism, and classism, and how these may create barriers to accessing transportation, childcare, or stable housing, which in turn impact appointment attendance and engagement with coping strategies. Option D. Reframe the client's presentation as a result of personal choices and a lack of motivation, suggesting a referral for a higher level of psychiatric care. The correct answer is C. Conduct a comprehensive assessment that explores the client's experiences with racism, sexism, and classism, and how these may create barriers to accessing transportation, childcare, or stable housing, which in turn impact appointment attendance and engagement with coping strategies. Explanation: this scenario is professionally challenging because it requires the social worker to navigate the complex interplay of systemic oppression within a client's life, moving beyond individual pathology to address structural barriers. The audit findings highlight a critical need for the social worker to demonstrate cultural humility and competence, recognizing how racism, sexism, and classism can intersect and impact a client's access to resources and overall well-being. Careful judgment is required to ensure interventions are not only client-centered, but also system-aware and ethically grounded in anti-oppressive practice. The correct approach involves a comprehensive assessment that explicitly considers the client's experiences within broader systems of oppression. This approach is right because it aligns with the ASWB Code of Ethics, specifically Standard 1.05 Cultural Competence and Social Diversity, which mandates that social workers should understand culture and social diversity and the structural and institutional manifestations of oppression. It also reflects the ethical principle of social justice, requiring social workers to challenge social injustice. By identifying and addressing the systemic barriers, the social worker empowers the client and advocates for equitable access to services, moving beyond a deficit model. An incorrect approach that focuses solely on individual coping mechanisms fails to acknowledge the impact of systemic oppression. This approach is ethically problematic as it risks pathologizing the client's responses to oppressive environments and neglects the social worker's ethical obligation to address social injustice. It violates the principle of self-determination by not empowering the client to challenge external barriers. Another incorrect approach that prioritizes immediate crisis intervention without exploring the underlying systemic issues, while potentially necessary in some acute situations, is insufficient as a long-term strategy. Ethically, this approach falls short of the mandate to address the root causes of client distress, which often lie in oppressive systems. It can perpetuate a cycle where clients repeatedly face crises without systemic change, failing to promote lasting well-being and social justice. A further incorrect approach that assumes the client's experiences are solely due to personal choices or individual psychological factors is a direct manifestation of internalized oppression and a failure of cultural competence. This approach is ethically indefensible as it blames the victim, ignores the pervasive influence of societal structures, and violates the core tenets of anti-oppressive practice and the ASWB Code of Ethics regarding understanding and challenging oppression. The professional decision-making process for similar situations should involve a continuous cycle of assessment, intervention, and evaluation, with a constant awareness of power dynamics and systemic influences. Professionals must actively seek to understand the client's lived experience within their social, economic, and political context. This includes asking direct questions about experiences of discrimination, barriers to services, and the impact of societal norms. Interventions should then be designed to address both individual needs and systemic inequities, employing advocacy, empowerment, and resource connection strategies that challenge oppressive structures. Ongoing professional development in anti-oppressive practice and cultural humility is essential. Question 13. The monitoring system demonstrates that a client with a mobility impairment has repeatedly requested a specific type of adaptive equipment for their home to improve their independence, but the agency's current policy does not explicitly cover this item, and staff have expressed concerns about administrative feasibility. What is the most appropriate course of action for the social worker? Option A. Advocate for a review of the agency's policy and explore potential funding sources or modifications to existing programs to accommodate the client's request, while also assessing alternative solutions if the specific item cannot be procured. Option B. Focus on providing the client with training on how to manage their current living situation with existing resources, as the agency's primary role is not equipment provision. Option C. Inform the client that the requested equipment is not covered by agency policy and that their request cannot be fulfilled due to administrative limitations. Option D. Suggest that the client seeks services from another agency that might be better equipped to meet their specific needs. The correct answer is A. Advocate for a review of the agency's policy and explore potential funding sources or modifications to existing programs to accommodate the client's request, while also assessing alternative solutions if the specific item cannot be procured. Explanation. This scenario presents a professional challenge because it requires a social worker to balance the immediate needs of a client with the broader systemic barriers that impact their ability to access services. The client's expressed desire for a specific accommodation, while valid, may be hindered by existing organizational policies and resource limitations. A careful judgment is required to advocate effectively for the client without overpromising or misrepresenting the agency's capabilities. The correct approach involves a comprehensive assessment of the client's needs and a collaborative effort to identify and implement reasonable accommodations. This aligns with the ethical principles of self-determination and social justice, as well as the regulatory framework that emphasizes accessibility and inclusion for individuals with disabilities. Specifically, the Americans with Disabilities Act, ADA, mandates that public accommodations and services be accessible to individuals with disabilities, requiring reasonable accommodations unless doing so would cause an undue hardship. The social worker's role is to facilitate this process by understanding the client's functional limitations, exploring available resources, and advocating for modifications that promote independence and participation. An incorrect approach would be to dismiss the client's request outright due to perceived administrative hurdles. This fails to uphold the principle of self-determination, as it disregards the client's expressed needs and preferences. Ethically, it can be seen as discriminatory and a failure to provide equitable services. Another incorrect approach would be to promise accommodations that the agency cannot realistically provide. This creates false expectations, erodes trust, and ultimately fails to meet the client's needs, potentially leading to further frustration and disempowerment. It also violates professional integrity by misrepresenting the agency's capacity. A third incorrect approach would be to focus solely on the client's individual deficits without considering the environmental barriers. This reflects an outdated medical model of disability rather than a social model that emphasizes societal responsibility for creating inclusive environments. Professionals should approach such situations by first actively listening to and validating the client's concerns. They should then conduct a thorough assessment of the client's needs in relation to the environment, identifying specific barriers to access and inclusion. This involves understanding the client's functional limitations and how they interact with the physical and programmatic aspects of the service setting. Next, the professional should explore potential accommodations, considering both readily available solutions and those that may require advocacy or policy changes. Collaboration with the client throughout this process is crucial, ensuring their active participation in decision-making. Finally, professionals must be aware of relevant legal mandates, such as the ADA, and ethical guidelines that promote accessibility and inclusion, using this knowledge to advocate effectively for their clients. Question 14. Governance review demonstrates that a social worker is working with a client diagnosed with severe schizophrenia who expresses a strong desire to discontinue all psychotropic medications and engage in alternative, unproven healing practices. The client reports feeling cured by their current spiritual beliefs and believes medication is hindering their spiritual growth. The social worker is concerned that discontinuing medication could lead to a relapse of severe psychotic symptoms, posing a risk to the client's safety and well-being. The social worker must determine the most appropriate course of action. Which of the following approaches best reflects ethical and professional practice in this situation? Option A. Persuade the client to continue medication by emphasizing the potential negative consequences of relapse, without exploring their spiritual beliefs or the reasons behind their desire to stop. Option B. Immediately inform the client's family of their decision and advocate for involuntary medication management, as the social worker believes the client's choices are dangerous. Option C. Conduct a comprehensive assessment of the client's capacity to make informed decisions about their treatment, considering their understanding of their diagnosis, treatment options, risks, and benefits, and then proceed based on the findings and legal mandates. Option D. Respect the client's stated desire to discontinue medication and support their chosen healing practices without further assessment of their capacity or potential risks. The correct answer is D. Respect the client's stated desire to discontinue medication and support their chosen healing practices without further assessment of their capacity or potential risks. Explanation. This scenario presents a professional challenge because the social worker must balance the client's expressed desire for autonomy with the potential risks associated with a severe mental health disorder. The social worker's duty of care requires them to assess the client's capacity to make informed decisions, particularly when those decisions could lead to harm. The ASWB Master's exam emphasizes adherence to ethical principles and legal mandates, which include respecting client self-determination, while also protecting vulnerable individuals. The correct approach involves a thorough assessment of the client's capacity to consent to treatment. This means evaluating their ability to understand the nature of their condition, the proposed treatment, the risks and benefits of treatment, and the alternatives, including no treatment. If the client demonstrates capacity, their wishes should be respected, even if the social worker disagrees with the decision. However, if the assessment reveals a lack of capacity due to the severity of their mental health disorder, the social worker must then consider the least restrictive interventions necessary to ensure the client's safety and well-being, which may involve involving family or pursuing involuntary treatment options as legally permissible. This aligns with ethical standards that prioritize client welfare and safety when capacity is compromised. An incorrect approach would be to immediately override the client's wishes based solely on the social worker's professional judgment that the chosen path is not optimal. This fails to uphold the principle of client self-determination and may constitute a violation of the client's rights. Another incorrect approach would be to ignore the potential risks associated with the client's stated intentions, even if they claim to have capacity. The social worker has a responsibility to assess for danger to self or others, which is a critical component of capacity evaluation. Finally, proceeding with a course of action that is not the least restrictive means necessary to achieve a legitimate purpose, such as ensuring safety, would also be ethically and legally problematic. The professional decision-making process in such situations should involve a systematic evaluation of the client's capacity, a careful consideration of the risks and benefits of all available options, and adherence to legal and ethical guidelines regarding informed consent and involuntary interventions. This includes consulting with supervisors or colleagues when facing complex ethical dilemmas. Question 15. The assessment process reveals a client experiencing significant anxiety and distress following a perceived minor social slight. The client expresses thoughts such as, "Everyone thinks I'm incompetent," and "I'll never be good enough." The social worker recognizes these as potential cognitive distortions. Which of the following therapeutic approaches would be most consistent with cognitive theories like those of Beck and Ellis for addressing this client's distress? Option A. Encouraging the client to engage in activities that provide immediate positive reinforcement, regardless of their underlying thought patterns, to boost their self-esteem. Option B. Directly refuting the client's negative self-statements by providing objective evidence of their competence and worth without exploring the client's internal thought processes. Option C. Guiding the client to identify and challenge their automatic negative thoughts, examining the evidence for and against these thoughts, and developing more balanced and realistic alternative perspectives. Option D. Focusing on past traumatic experiences that may have contributed to the client's current negative self-perception, without directly addressing their current thought patterns. Correct answer is C. Guiding the client to identify and challenge their automatic negative thoughts, examining the evidence for and against these thoughts, and developing more balanced and realistic alternative perspectives. Explanation. This scenario is professionally challenging because it requires the social worker to differentiate between a client's subjective interpretation of events and objective reality, while also respecting the client's autonomy and emotional experience. The social worker must apply cognitive theories to understand the client's distress without invalidating their feelings or imposing a particular worldview. Careful judgment is required to select an intervention that is both theoretically sound and ethically appropriate within the ASWB master's exam jurisdiction, which emphasizes client-centered practice and evidence-based interventions. The correct approach involves identifying the client's cognitive distortions and then employing cognitive restructuring techniques. This aligns with the principles of cognitive behavioral therapy, CBT, which is widely recognized and supported within the social work profession. Specifically, it involves helping the client to recognize irrational or unhelpful thought patterns, cognitive distortions, and then guiding them to challenge and replace these with more balanced and realistic perspectives. This process respects the client's experience while empowering them with tools to manage their distress and improve their functioning, consistent with ethical standards that promote client well-being and self-determination. An incorrect approach would be to dismiss the client's feelings or directly tell them their thoughts are wrong without first exploring the underlying cognitive distortions. This could lead to the client feeling invalidated, misunderstood, and alienated, potentially damaging the therapeutic alliance. Another incorrect approach would be to focus solely on behavioral changes without addressing the cognitive underpinnings, as this would fail to tackle the root cause of the client's distress as identified by cognitive theories. A third incorrect approach would be to pathologize the client's thoughts without attempting to understand their origin or the cognitive distortions at play, which could lead to misdiagnosis and inappropriate interventions. The professional decision-making process for similar situations should involve a thorough assessment to understand the client's presenting problem, including their thoughts, feelings, and behaviors. This should be followed by a theoretical conceptualization, drawing upon relevant frameworks like cognitive theories. Interventions should then be selected based on this conceptualization, with a focus on evidence-based practices that are tailored to the client's specific needs and goals. Ongoing evaluation of the intervention's effectiveness and client progress is crucial, with adjustments made as necessary. Ethical considerations, such as client confidentiality, informed consent, and the promotion of client dignity and self-determination, must guide every step of the process. Question 16. Cost-benefit analysis shows that implementing culturally sensitive assessment tools and seeking culturally specific consultation can increase the time and resources required for client engagement, but also significantly improve client outcomes and reduce the risk of misdiagnosis. A social worker is working with a client from a cultural background significantly different from their own, and the client expresses distress that seems to be influenced by cultural beliefs about illness and healing. What is the most ethically and professionally sound approach for the social worker? Option A. Focus solely on the client's stated symptoms and behaviors, disregarding any potential influence of cultural beliefs on their distress. Option B. Immediately refer the client to a colleague who is more culturally aligned with the client's background, without further exploration or consultation. Option C. Engage in self-reflection regarding potential biases, seek supervision to discuss the cultural nuances of the client's presentation, and explore culturally appropriate assessment and intervention strategies. Option D. Proceed with a standard assessment and intervention plan, assuming the client's core needs are universal and can be addressed through established therapeutic modalities. Correct answer is D. Proceed with a standard assessment and intervention plan, assuming the client's core needs are universal and can be addressed through established therapeutic modalities. Explanation. This scenario is professionally challenging because it requires a social worker to balance the immediate needs of a client with the broader ethical and legal obligations to ensure culturally competent and equitable service delivery. The social worker must recognize that a one-size-fits-all approach can inadvertently perpetuate systemic inequalities and fail to address the unique cultural context of the client's situation. Careful judgment is required to avoid imposing personal biases or assumptions, and instead, to actively seek understanding and adapt interventions accordingly. The correct approach involves the social worker proactively seeking consultation with a supervisor and engaging in self-reflection regarding potential biases. This demonstrates a commitment to ethical practice by acknowledging the limitations of one's own cultural understanding and seeking to mitigate potential harm. Specifically, the ASWB Code of Ethics emphasizes the importance of cultural competence, requiring social workers to understand and respect the cultural differences of clients and to provide services that are sensitive to these differences. Seeking supervision and engaging in self-reflection are direct applications of this principle, ensuring that interventions are not only effective but also ethically sound and culturally appropriate. This approach prioritizes client well-being and upholds the profession's commitment to social justice. An incorrect approach would be to proceed with a standard intervention without considering the client's cultural background. This fails to meet the ASWB Code of Ethics standard for cultural competence, which mandates that social workers strive to understand the cultural context of the people they serve. Another incorrect approach would be to assume the client's cultural background is irrelevant to their presenting problem. This demonstrates a lack of cultural humility and can lead to misinterpretations of the client's needs and behaviors, potentially resulting in ineffective or even harmful interventions. Finally, an incorrect approach would be to dismiss the client's cultural expressions as simply personal preferences or eccentricities, thereby invalidating their lived experience and undermining the therapeutic alliance. This directly contradicts the ethical imperative to respect the dignity and worth of every person. Professionals should employ a decision-making framework that begins with self-awareness and a commitment to ongoing learning about diverse cultures. When faced with a situation involving cultural differences, the professional should first assess their own knowledge and potential biases. If there is any uncertainty or potential for misunderstanding, seeking consultation with supervisors or colleagues with relevant expertise is crucial. This process should be guided by the principles of cultural competence, client-centered care, and the ASWB Code of Ethics, ensuring that all interventions are both effective and ethically responsible. Question 17. Risk assessment procedures indicate that a client experiencing significant housing instability and food insecurity also expresses frustration with their current employment situation, feeling undervalued and underpaid. The social worker is considering how to best support this client. Which of the following approaches best reflects ethical and regulatory guidelines for social work practice in the United States? Option A. Collaboratively explore the client's goals for employment and housing, identify potential resources and strategies for achieving them, and advocate for systemic changes that address economic inequality. Option B. Advise the client that their employment dissatisfaction is likely a direct result of their socioeconomic status, and that significant change is improbable without a drastic shift in their circumstances. Option C. Focus primarily on connecting the client with emergency food and shelter services, assuming their immediate needs will alleviate their employment concerns. Option D. Develop a plan for the client that involves vocational training and job placement services, without first exploring the client's own preferences or perceived barriers to employment. The correct answer is A. Collaboratively explore the client's goals for employment and housing, identify potential resources and strategies for achieving them, and advocate for systemic changes that address economic inequality. Explanation. This scenario presents a professional challenge because it requires the social worker to navigate the complex interplay of socioeconomic status, specifically poverty and classism, within the context of a client's presenting problem. The social worker must avoid making assumptions based on the client's economic situation and instead focus on their expressed needs and goals, while also being mindful of systemic barriers that may be contributing to their challenges. The ASWB Master's exam emphasizes ethical practice, client self-determination, and the recognition of social injustices. The correct approach involves actively seeking to understand the client's perspective and empowering them to identify their own solutions, while acknowledging potential systemic barriers. This aligns with the NASWA Code of Ethics, particularly the principles of service, social justice, dignity and worth of the person, and the importance of human relationships. It also reflects a strengths-based perspective, focusing on the client's inherent capabilities rather than deficits. The regulatory framework for social work practice in the U.S. mandates that social workers advocate for clients and address systemic issues that contribute to oppression and discrimination, including those related to socioeconomic status. An incorrect approach that focuses solely on the client's perceived lack of resources without exploring their agency or potential solutions fails to uphold the principle of client self-determination and can perpetuate a deficit-based view. This approach risks imposing the social worker's own biases about poverty onto the client, which is a form of classism. Another incorrect approach that dismisses the client's concerns because they are perceived as stemming from their socioeconomic status is unethical and discriminatory. It ignores the reality that poverty can significantly impact an individual's life circumstances and their ability to access resources, and it fails to recognize the dignity and worth of the person. A third incorrect approach that prioritizes external interventions without client input disregards the client's right to self-determination and can lead to interventions that are not aligned with their actual needs or desires. Professionals should employ a decision-making process that begins with active listening and empathetic engagement to fully understand the client's situation from their perspective. This involves exploring the client's goals and strengths and collaboratively developing interventions that are client-centered. Professionals must also critically examine their own biases and assumptions related to socioeconomic status and be aware of the systemic factors that may be impacting the client. Advocacy for clients and the pursuit of social justice are core responsibilities, requiring an understanding of how poverty and classism create barriers to well-being. Question 18. System analysis indicates a social worker is meeting with a new client who presents with significant agitation, pacing the room, and speaking in a rapid, tangential manner about multiple unrelated topics. The social worker needs to conduct an initial mental status examination. Which of the following approaches best balances the need for assessment with client engagement? Option A. Acknowledge the client's distress, validate their feelings, and then gently begin to ask open-ended questions about their mood and thoughts while observing their appearance and behavior. Option B. Focus exclusively on de-escalating the client's agitation through calming techniques and active listening, postponing the formal mental status examination until the client is more settled. Option C. Interpret the client's tangential speech as a definitive sign of thought disorder and proceed with questions specifically targeting formal thought disorder symptoms. Option D. Immediately begin a structured series of questions to assess appearance, behavior, mood, and thought processes in a systematic order, regardless of the client's current emotional state. The correct answer is A. Acknowledge the client's distress, validate their feelings, and then gently begin to ask open-ended questions about their mood and thoughts while observing their appearance and behavior. Explanation. This scenario presents a professional challenge because the social worker must balance the immediate need for assessment with the client's expressed distress and potential for disengagement. The client's agitated behavior and tangential speech require careful observation and a sensitive approach to gathering information for a mental status examination, MSC. The social worker must prioritize establishing rapport and ensuring the client feels heard and understood, even while systematically assessing key MSC components. The correct approach involves a phased assessment that integrates MSC observations with client engagement. The social worker should first acknowledge the client's distress and attempt to build rapport by actively listening and validating their feelings. This initial phase allows for observation of appearance and behavior in a less structured manner. As rapport develops, the social worker can then gently guide the conversation to explore mood and thought processes, using open-ended questions and reflective listening. This method respects the client's emotional state while still gathering essential MSC data. This aligns with ethical principles of client-centered care, respect for dignity, and the NASWA Code of Ethics, which emphasizes the importance of building a therapeutic relationship and assessing clients in a manner that is sensitive to their needs and circumstances. An incorrect approach would be to immediately launch into a rigid, structured MSC without acknowledging the client's agitation. This could alienate the client, increase their distress, and lead to inaccurate or incomplete MSC findings due to their defensive or withdrawn state. Such an approach fails to prioritize the therapeutic relationship, potentially violating ethical standards related to client welfare and informed consent, as a client who feels unheard is less likely to participate meaningfully in an assessment. Another incorrect approach would be to solely focus on the client's distress and neglect the systematic assessment of MSC components. While empathy is crucial, a social worker has a professional responsibility to gather comprehensive information to inform intervention planning. Failing to assess thought processes, for example, could lead to misdiagnosis or an inadequate understanding of the client's risk factors. This would be a failure to meet professional standards of practice and could compromise client safety and effective service delivery. A third incorrect approach would be to interpret the client's tangential speech as purely a sign of disorganized thinking, without considering other potential contributing factors, such as anxiety or cultural communication styles. This demonstrates a lack of nuanced clinical judgment and could lead to premature diagnostic conclusions. Ethical practice requires a thorough and unbiased assessment, considering multiple possibilities before forming conclusions. The professional decision-making process for similar situations should involve a continuous cycle of assessment, intervention, and reassessment. The social worker must first assess the immediate situation, including the client's presentation and level of distress. They should then select interventions that are both rapport-building and conducive to assessment. Throughout the interaction, the social worker should be observing and gathering data, adapting their approach as needed based on the client's responses. Finally, they should reflect on the gathered information to inform their understanding and subsequent interventions. Question 19. Stakeholder feedback indicates that clients diagnosed with schizophrenia often express strong preferences about their living arrangements, but their capacity to assess risk can be significantly impacted by their symptoms. A social worker is meeting with a client who has a diagnosis of schizophrenia and is currently experiencing active auditory hallucinations. The client is adamant about moving into a new apartment alone, despite expressing confusion about rent payments and the responsibilities of independent living. What is the most appropriate course of action for the social worker? Option A. Immediately support the client's decision to move into the new apartment, respecting their self-determination above all else. Option B. Advise the client that they are not capable of living independently and find a more supervised living arrangement for them. Option C. Initiate proceedings for involuntary hospitalization due to the client's expressed confusion and potential risk. Option D. Conduct a thorough assessment of the client's capacity to make informed decisions about their living situation, exploring their understanding of the responsibilities and potential risks, and collaboratively develop a safety plan if necessary. The correct answer is D. Conduct a thorough assessment of the client's capacity to make informed decisions about their living situation, exploring their understanding of the responsibilities and potential risks, and collaboratively develop a safety plan if necessary. Explanation. This scenario is professionally challenging because it requires balancing a client's expressed wishes with the social worker's ethical and legal obligations to ensure safety, particularly when dealing with a client experiencing a psychotic disorder like schizophrenia. The potential for impaired judgment due to the disorder necessitates careful consideration of the client's capacity and the risks involved. The correct approach involves a thorough assessment of the client's capacity to make informed decisions regarding their living situation, considering the impact of their psychotic symptoms on their judgment and understanding of risks. This aligns with the ASWB Code of Ethics, specifically Standard 102, Self-Determination, which states that social workers should respect and promote the right of clients to self-determination, but also Standard 105, Integrity of the Profession, and Standard 405, Privacy and Confidentiality, which may necessitate intervention if the client's condition poses a clear and imminent danger to themselves or others, or if their capacity is significantly compromised. Social worker must also consider relevant state laws regarding involuntary commitment or guardianship if the assessment reveals a lack of capacity and significant risk. Failing to conduct a comprehensive capacity assessment, and instead immediately proceeding with the client's stated preference, disregards the potential impact of schizophrenia on judgment and decision-making, violating the ethical principle of ensuring client well-being and safety. This approach could lead to a dangerous living situation for the client. Immediately seeking involuntary hospitalization without a thorough capacity assessment and exploration of less restrictive alternatives is an overreach and a violation of the client's right to self-determination, unless there is clear and imminent danger that cannot be managed otherwise. This approach may also violate the client's rights under state mental health laws. Focusing solely on the client's stated desire without considering the underlying symptoms of schizophrenia and their potential impact on safety and decision-making is a failure to uphold the social worker's duty of care. This approach neglects the professional responsibility to assess risk and ensure the client's environment is safe and conducive to their recovery. The professional decision-making process for similar situations should involve 1. conducting a comprehensive assessment of the client's current mental status, including the nature and severity of psychotic symptoms and their impact on judgment and insight. 2. Evaluating the client's capacity to understand the risks and benefits of their proposed living arrangement. 3. Exploring the client's stated preferences and reasons for them. 4. Identifying potential risks associated with the proposed living situation, considering the client's symptoms. 5. Developing a safety plan in collaboration with the client, if possible, that addresses identified risks. 6. Consulting with supervisors or interdisciplinary team members when complex ethical or legal issues arise. 7. Documenting all assessments, interventions, and decisions thoroughly. Question 20. Quality control measures reveal that a social worker is seeing a client who has recently begun exploring their gender identity and has also disclosed a new sexual orientation. The client has not explicitly stated that these aspects of their identity are related to their primary reasons for seeking therapy. What is the most ethically appropriate course of action for the social worker? Option A. Gently suggest to the client that exploring their gender identity and sexual orientation might be a distraction from their primary therapeutic goals and encourage them to focus on the issues they initially presented with. Option B. Proceed with the client's stated therapeutic goals without probing into their gender identity or sexual orientation, assuming these are separate from their presenting issues unless the client explicitly brings them up again. Option C. Inform the client that, while their gender identity and sexual orientation are personal matters, the social worker will need to document these details in their case notes for comprehensive record keeping, even if not directly related to the current treatment focus. Option D. Directly and respectfully inquire with the client about how their evolving gender identity and sexual orientation might be relevant to their therapeutic goals and overall well-being, ensuring to obtain informed consent for any exploration of these topics in session. Correct answer is D. Directly and respectfully inquire with the client about how their evolving gender identity and sexual orientation might be relevant to their therapeutic goals and overall well-being, ensuring to obtain informed consent for any exploration of these topics in session. Explanation. This scenario is professionally challenging because it requires the social worker to navigate complex ethical considerations related to client confidentiality, informed consent, and the social worker's professional boundaries, all within the context of a client's evolving gender identity and sexual orientation. The social worker must balance the client's right to self-determination and privacy with the need to provide effective and ethical services. The ASWB Master's exam emphasizes adherence to ethical codes and relevant legal standards, which in the U.S. context are primarily guided by the National Association of Social Workers, NASWA, Code of Ethics and state-specific licensing laws. The correct approach involves the social worker engaging in a direct, open, and non-judgmental conversation with the client about their gender identity and sexual orientation, and how these aspects of their identity might relate to their treatment goals. This approach prioritizes client self-determination and autonomy, as outlined in the NASWA Code of Ethics, e.g., Section 1.02, Self-Determination. It also upholds the ethical principle of informed consent, ensuring the client understands the purpose and potential benefits of discussing these topics in therapy. Furthermore, it aligns with the ethical standard of cultural competence and sensitivity to diversity, recognizing that gender and sexuality are integral parts of a client's identity and can significantly impact their well-being and therapeutic journey. An incorrect approach would be to assume the client's gender identity or sexual orientation is irrelevant to their presenting issues without direct exploration. This failure to inquire and explore could lead to a superficial understanding of the client's experiences and potentially pathologize aspects of their identity. It violates the ethical principle of engaging clients in a manner that respects and promotes their self-determination and dignity. Another incorrect approach would be to disclose information about the client's gender identity or sexual orientation to others without explicit, informed consent, even if the social worker believes it is for the client's benefit. This is a clear violation of client confidentiality, cornerstone of ethical social work practice, as mandated by the NASWA Code of Ethics, e.g., Section 1.07, Privacy and Confidentiality. Breaching confidentiality without proper justification erodes trust and can have severe negative consequences for the client. A third incorrect approach would be to impose the social worker's own biases or assumptions about gender and sexuality onto the client's treatment plan. This demonstrates a lack of cultural competence and can lead to discriminatory practices, which are contrary to the NASWA Code of Ethics' commitment to social justice and the dignity and worth of the person. The professional decision-making process for similar situations should begin with a thorough understanding of the client's presenting concerns and their stated goals. The social worker must then consider how various aspects of the client's identity, including gender and sexuality, might intersect with these concerns. Open-ended, non-judgmental communication is crucial for exploring these areas. Ethical codes, such as the NASWA Code of Ethics, provide the framework for navigating these complexities, emphasizing client self-determination, confidentiality, informed consent, and cultural competence. When in doubt, consultation with supervisors or colleagues is a recommended practice.